So the first question is for you, Philip, I think, but
Mhm.
maybe others can answer also. Why would a heat wave damage building in the long term? This was
Well, yeah, okay. Maybe I did not explain that well. The concept of the graph I showed is not referring to the building or the material of the building. It's more related to the indoor conditions. So a heat wave usually would not damage the building itself. I mean, it can happen that some technical systems might, get destroyed due to some disruptive events, but not heat waves usually. So why? Yeah, heat waves would not damage buildings. I think that's the question here.
Okay.
Definition of I hope that's clear. So definition of resilience. How is redundancy considered? Redundancy is a commonly used design strategy for designing critical life support systems. That's true. It's how we nowadays make sure that buildings in very critical care buildings are not overheating, or in case of power outages remain the desired indoor conditions. This was, if you remember the slides when I was talking about the thermal comfort models we apply, there is like the discussion for in the standard EN 15251. So where you have this building classes 1 to 4, and if the building is a class 1 building, then of course redundancy is a very say viable concept of resilience. For residential buildings or buildings that are not that crucial or critical, we did not consider redundancy as a concept of resilience. I think, yeah.
Okay.
I hope that has been answered.
Yeah, I think so. Thank you. In any case, if you want to ask additional question, you can use the Q&A box during the Q&A session, and Maria is copying it around it. So if you feel that you still have question, do not hesitate to add a new question in the Q&A box. We have a question from Mohammed here. Learning from experience, are dry runs or emergency drills applicable to resilient design via the operation and maintenance phases?
Yes, hello.
Yeah.
So I see the question, learning from experience, are dry runs or emergency drills applicable for resilient design for this operation and maintenance phase? I'm not 100% sure about what do you mean by emergency drills, but so I need clarification about this point, if possible, in order to be able to answer the question.
Okay, so if you are the one asking this question, please put some additional info in the Q&A, and we will get back to your question later. So we can move to
if I go to the second question about how to generalize the method, the reference is usually what is written in the standard. Actually, yes, there is different like numbers is needed to have thresholds, so it can be taken from standard or from studies. Because not all these values can be found in standard, because, for example, but in general, yes, the method can be generalized by different assumptions, different considering different events and different condition in different buildings and different countries. Yeah.
Okay, well, there is one just coming. Current damage. An HVAC tech in San Francisco area told me he has seen rooftop units blow out plastic connection during hot weather exam fire drills.
Okay. Yeah, it's all. Yeah, I think the method also, it can, if this is like events, it can be also handled for particular zones where this HVAC system serve.
Okay. Okay, we can move on now to the questions to Aziz. How are the thermal health metrics for human performance and productivity considered in overrating assessment? Arval and other group have documented such effects.
Well, in our work, we haven't looked at human performance and productivity, but they are, as a matter of fact, affected by heat. We looked only to protect the people when there is a heat wave. So basically, we looked at limiting the most important stuff which are found in existing heat waves is body dehydration and stroke. Stroke is or thermal stroke or heat stroke. These are the main causes for mortality found in previous heat wave events, the one 2003 in Europe and other places. So basically limiting these two stuff, core temperature and body dehydration in order to avoid any health. But of course, yes, the productivity of people and the performance, human performance will be affected by heat.
Okay. So you have a positive comment here. Is there excellent work? Is there an intention to further adapt the UTCI index for outdoor comfort as well, just like you have done now for SET?
Yes, the UTCI is an index used for outdoor environment. It is a correlation based. It is an index itself, but it is not linked to body to physiological model for human body directly. It was developed using a human physiological body, but the index itself, it just gives you a number. It could be used for heat waves in the outdoor environment, but in order to link it to how a human body behaves when it is exposed under outdoor environment, we need additional work to link this index to what happens in the body in terms of body dehydration and core temperature.
How do we determine the joint probability of occurrence during a heat wave or type of heat wave? Do we have good data on this?
This is still under development. I don't have an answer to this question.
Okay. How to generalize your method? Yeah.
Yeah, the method is a general method. It can be applied to any case of indoor environment. I don't see any issue with that. And we are using or applying the method to a number of vulnerable buildings. I mentioned the 4 ones in my presentation, but there are other buildings. We are working on them as well. We have done also field measurement. So any building model that we develop is as well calibrated using field measurement in order to get an idea about the indoor temperature. So simulation itself, it just gives you numbers, but it needs to be substituted by some real data.
Okay, here, very interesting insight of the risk of fan ventilation for older residents due to their lower vasodilatation capacity. Does that explain the increased vulnerability of people with heart disease to heat exposure? Have you looked at clinical data on that?
The short answer, no, we haven't looked at this one. Yes, but people with existing sickness will suffer a lot compared to healthy people. And we need to take into account this factor in any setting to limit overheating in buildings.
Yeah,
And the work that I presented is actually for healthy young people and healthy older people. We haven't looked at other type of vulnerable people, especially people with medication or people with diabetes or other diseases.
Yeah, and to check whether the vasodilatation capacity have a link with heart disease or not. I think that was the idea of this question. Is there a link?
Yeah, this is, yeah.
Okay. Other question for you again. How the occupants in the building 100% of the time during the heat waves? Are they in the building 100% of the time during the heat waves?
Yes, for residential buildings, yes, they are there, but they change spaces. During daytime, they are in living rooms. During nighttime, for sleeping, they are in bedrooms. For long-term care homes or buildings, they don't stay in their rooms. They have at least 1 hour during in the morning for breakfast, to around 2 hours for lunch, and 2 hours in the evening for dinner. And these are not in their rooms. It's in the common spaces or lounges or cafeteria. So we take into account these environments in order to evaluate overheating, and this is what I call evaluation overheating from the occupant based approach. So we look to what occupant moves in the building, and we take the environment condition from there and evaluate overheating. And this is different when you evaluate overheating for a fixed space. You have a room and you carry out overheating assessment. It stays there. But people, they change environment for whatever reason.
Okay. We will move on to this general question that I think is addressed to all of you. Like pretty much all of the research in the area, you have focused on extreme heat wave events and disruptive. Could you comment on the effect risk of generally altered, warmer, humidifier baseline condition? Are we not missing something by ignoring the elevated baseline temperatures?
Well, from my side here, the standard effective temperature is an index that takes into account temperature, relative humidity, people activity, etc. So if we know these parameters, we can evaluate overheating. For example, using desiccant cooling in buildings to basically eliminating or reducing relative humidity in the space. This is taken into account by the index, the standard effective temperature directly there.
Okay, do other speakers want to comment on that?
Well, in terms of disruptive events, these are already, they're addressed in the terms of the prevailing thermal conditions in the area. So, for instance, heat waves, the threshold when a heat wave occurs is dependent on the prevailing conditions in this area, and we assess these in our midterm, short-term, and long-term weather data. So 2020, 2050, 2100. So it is taking into account the elevated baseline temperatures.
Okay.
Maybe I can add one point here.
Sorry.
Yeah. Actually, in the framework which I introduced today, there is extension. Like we still also working to consider like normal condition before and after the event when the building recovered to the baseline. So this is we are working on it, and I think it needs to be considered in the holistic assessment method. So I somehow agree on that, but we needed here to focus on disruptive event where we need to investigate further because it has not been investigated enough before.
Okay, thank you. Then we have another general comment for everybody here. Thank you for your thoughtful work. What are the plans to implement your recommendation for various users? Many users need a simple approach, and all users need simple graphical tool and messaging to convey the info to the public, client, etc.
Yeah, I think this is the next step in at least in my work, is to have simple stuff like simple guidelines that addresses different users, and we are not at that level. The second thing is to try to modify building energy codes to take into account the health aspect of heat waves. So when designing buildings, the effect of heat on people's health should be taken into account. So there's a lot of work to be done in this area. And there are many also researchers around the world working in this field, and hopefully in the upcoming years something will emerge for general public.
Okay, so I think we have a lot of new questions that came here for Philip.
I think number 3. So,
yeah,
of course, the concept can be applied to existing buildings, but the problem is that how do you then you have to wait for a heat wave. If you have existing monitored data, then you can still assess the building in terms of resilience. It's a matter of the thresholds. Yeah. So this is the short answer to this question. We're about to publish a paper where we will look at this, especially this quantitative assessment of resilience.
okay, so you need a real heat wave if you want to assess it on real building. That's basically what is difficult. Okay. From what I understood from the presentation and publications, failure is an important aspect in the definition of resilience, but that would also mean that the building being able to fulfill comfort during a disruptive event, example causing discomfort failure in other building, will not be considered resilient, but only robust. In short, why is the failure so critical in the definition?
Well, I would say it's in the nature of the definition. Otherwise, it's a robust building, which I would say is perfectly fine. But if there is no failure, then there's no ability to really build back better, as in the Sendai framework, but to bounce back to normal conditions. This is just how it has been defined, but it's not saying that it has to be like this. But as we experience more and more severe heat waves in the future, there will be more disruptive events and more failures of buildings. This is what we have to expect. So that's why it's good to prepare and talk about this. Yeah.
Thank you all for the clear presentation. I understand that the work related to existing building. I wonder what the consideration would be when operating modern energy efficient home. Do you treat them as having the same vulnerabilities as the existing building, as same KPI and so on? How about the overheating generated not due to heat wave but due to modern design? Are you considering the case of modern homes?
Yes.
Yes.
Go ahead.
No, I'm happy if you can answer.
Oh, I answer from my side. Old buildings are not treated in similar way as new buildings, but the what you call the KPI indices are applied for both of them. For example, old buildings usually are leaky and not well insulated. The heat wave has less effect. However, for new buildings which are highly insulated, I have also high internal heat gains from equipment or people, etc. They have different. These internal heat gains will affect the overheating event. So, is a component that affect overheating event, and they are treated differently. And this is why in the graph that I showed for new buildings, because buildings are well insulated, any heat accumulated in the space, it will be difficult to get rid of it during the heat wave and after the heat wave, unless the space is not ventilated. So they are treated differently, and the results are different, and the design also is different.
Thank you. Here we don't have more questions for Aziz, I think. Sorry.
Yeah, I just wanted to add one more thing to the previous question about existing building and new buildings. So in the methodology, when we assess overheating, overheating can be assessed before we assess overheating indoor. We have to know which event going to make overheating for the building and how much. So of course, if the building is very well insulated, like passive houses, maybe there is base case based temperature. After this base temperature, which is maybe can be low, like 16. If the temperature is outside, the temperature is higher, it could cause overheating in those buildings. But the same, like if the outdoor temperature is above this base temperature for all the buildings, the base temperature can be 18 or 19 if the building is less insulated. So of course, in the methodology, there is differentiation between different type of building can be considered. This is what I would like to say.
Okay. Yeah, I think here we have more question to ask.
One more question, because we are already at the end of our time. I mean, I don't know if people still have time to. If there's just one question, then I think we go ahead with this one question.
Okay, I think this one is new, and then we can stop the meeting if you want. Yeah. Do you know if the INIVE plans to integrate a methodology for thermal comfort in summer?
And I don't know exactly, but I know that there is so far there is no provision for operating an INIVE. But the topic is being discussed. I know in British Columbia they are trying to accommodate this topic in their code, step energy code, but the work is still going on.
Okay, thank you. So yeah, I think there is an interesting comment here saying that people need to become a bit more resilient and not just building. Probably that's true, but that's another topic.